Hello, a pleasure to be with you again. Thanks for being here. Let's see. We tend to think that the diseases that can affect a dog are more common in old age. However, these diseases can appear in dogs of any age, and if they are not treated properly, they can be fatal. In this video we summarize what these pathologies are and how you can prevent and treat them. Knowing its symptoms, you can be more attentive to the appearance of any possible pathology. 1. Chronic kidney failure. Kidney failure is a pathology typical of elderly dogs and is characterized by weight loss, bad fur, increased water consumption and urination, hypertension, anemia, halitosis, protein in the urine, proteinuria, decreased potassium in the blood, hypokalemia, increased phosphorus in the blood, hyperphosphatemia. You should know that in this particular pathology, diet plays a determining role. Therefore, sodium and protein intake must be restricted and water must be provided, permanently available. 2. Distemper or distemper. This pathology is caused by a morbillivirus, a group of viruses that also causes measles in humans. Distemper is normally transmitted by the respiratory route and affects many species of carnivores, foxes, wolves, coyotes or big cats. In the case of dogs, it is especially virulent in puppies between 3 and 6 months of age. It is a systemic disease that can affect the respiratory system, the lymph nodes, and the nervous system. Some of the most characteristic signs are conjunctivitis, fever, listlessness, shortness of breath, or nervous signs, such as incoordination or seizures. Its treatment is symptomatic, as in the majority of viral infections. 3. Canine parvovirus. It is a highly contagious viral disease. Although it can manifest at any age, it is usually more severe in puppies. It is produced by a parvovirus, which is transmitted mainly through the feces of another infected dog. In case of infection, your pet will show the following symptoms: bloody diarrhea, vomiting, fever, dehydration, apathy, loss of appetite, drop of leukocytes in the blood. In some cases, a secondary bacterial infection can be generated that will require antibiotics for treatment. It is necessary to make a differential diagnosis with respect to other infectious diseases with gastrointestinal signs, such as those caused by infection by coronavirus, rotavirus, enterobacteria or canine distemper. Treatment, as in the case of parvovirus, will be symptomatic, especially treating dehydration and fever. Prevention is the best treatment, so it is essential to vaccinate puppies. 4. Leptospirosis. This disease is caused by the Leptospirobacteria, transmitted mainly by the urine of infected animals, including carrier species such as rodents. Leptospirosis can worsen quickly and in the most severe stages mortality rises considerably. The main symptoms are hyperthermia or fever, vomiting, diarrhea, kidney and liver failure, nasal congestion, or muscle pain. For its treatment, antibiotics and analgesics will be administered, in addition to treating the symptoms with antiemetics and antidiarrheals. To prevent this disease, try to prevent your pet from smelling the urine of other dogs that could be carriers. 5. Canine Coronavirus. It is a very contagious intestinal viral infection that is transmitted by the orofecal route, with puppies being the most susceptible to contracting it. The coronavirus mainly causes enteritis or intestinal inflammation, affecting cells located in the microvilli of the small intestine, which alters the ability to absorb nutrients. In addition, there is an immunosuppression or involvement of the immune system. Filariasis. The cause of canine heartworm is a parasitic worm, transmitted by vector mosquitoes. It is quite prevalent in the Mediterranean basin, since the climatic conditions of this region are ideal for the proliferation of these vectors. In addition, it is important to note that this parasite can be transmitted to humans, although never directly from the dog, but through a vector. In its earliest stage, symptoms are usually very mild, however, when the worms reach the heart or lungs, it is severe. 7. Neoplasia. The neoplasia consists of the abnormal proliferation of cells at a local level, which leads to hyperplasia or excessive tissue growth, which can alter the function of the affected organs. Depending on various factors such as cellular alterations, the region where it is located or the extent of the neoplasm, this pathology can be benign, for example, a cutaneous adenoma or lipoma, or malignant, for example, a mastocytoma or breast carcinoma. The risk of developing a neoplasm increases with age, which is why it is more frequent in geriatric or old animals. In short, Ensuring that your pet receives the necessary vaccines, in addition to subjecting him to adequate deworming and ensuring that he receives a periodic checkup at the vet, will help prevent the appearance of these diseases that can endanger his health or even his life. I hope this video helps you understand a little more. In the description of this video you have information to make your dog a happy and healthy animal. Click there. Subscribe to our channel. Take care and a hug.